Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A 27-year-old prima gravida client with insulin-dependent diabetes at 34 weeks gestation undergoes a non-stress test, the results of which are documented as reactive. The nurse should tell the client that the test results indicate which of the following? 1. A contraction stress test is necessary. 2. The non-stress test should be repeated. 3. Chorionic villus sampling is necessary. 4. There is evidence of fetal well-being. The correct answer is 4. The non-stress test is considered reactive when 2 or more fetal heart rate accelerations of at least 15 BPM occur, along with fetal movement, during a 10 to 20-minute period. A reactive non-stress test indicates fetal heart rate accelerations and well-being. There is no indication for further evaluation. However, contraction stress tests are commonly scheduled for pregnant clients with insulin-dependent diabetes in the latter part of pregnancy and are repeated periodically until birth. Chorionic villus sampling is usually performed early in the pregnancy to detect fetal abnormalities. A client with gestational diabetes who is entering her 3rd trimester is learning how to monitor her fetus's movements. After teaching the client about the kick count, the nurse should provide further instruction if the client makes which of the following statements? 1. The baby may be more active at different times of the day. 2. How I feel my baby move is different than my friend. 3. The baby should be moving less than 10 times in 2 hours. 4. The baby may not move at times because it is asleep. The correct answer is 3. Feeling 4 kicks in 30 minutes or feeling 10 or more kicks in 2 hours are norms. Fetuses are more active at various times of the day, particularly after mother has eaten when the blood glucose level is high, and in the evening. Each individual perceives their fetus to move differently. Fetuses do sleep several times per day for about 30 minutes each time. A prima gravida client at 34 weeks gestation is experiencing contractions every 3 to 4 minutes, lasting for 35 seconds. Her cervix is 2 centimeters dilated and 50% effaced. While the nurse is assessing the client's vital signs, the client says, "I think my bag of water just broke." Which of the following would the nurse do first? 1. Check the status of the fetal heart rate. 2. Turn the client to her right side. 3. Test the leaking fluid with nitrazine paper. 4. Perform a sterile vaginal examination. The correct answer is 1. The priority is to determine whether a prolapsed cord has occurred as a result of the spontaneous rupture of membranes. The nurse's first action should be to check the status of the fetal heart rate. Complications of premature rupture of the membranes include a prolapsed cord or increased pressure on the fetal umbilical cord, inhibiting fetal nutrient supply. Variable decelerations or fetal bradycardia may be seen on the external fetal monitor. The cord also may be visible. Turning the client to her right side is not necessary. If the cord does prolapse, the client should be placed in a kneaded chest or Trendelenburg position. Checking the fluid with nitrazine paper and vaginal examination are appropriate once the status of the fetus has been evaluated. A prima gravida client at 36 weeks gestation with premature rupture of the membranes is to be discharged home on bed rest with follow-up by the home health nurse. After instruction about care while at home, which of the following client statements indicates effective teaching? 1. It is permissible to douche if the fluid irritates my vaginal area. 2. I can take either a tub bath or a shower when I feel like it. 3. I should limit my fluid intake to less than 1 quart daily. 4. I should contact a doctor if my temperature is 100.4 degrees Fahrenheit or higher. The correct answer is 4. Because of the client's increased risk for infection, successful teaching is indicated when the client states that she will contact a doctor if her temperature is 100.4 degrees Fahrenheit or greater. The client should be instructed to monitor her temperature twice daily. The client should refrain from douching and tub bathing, which can increase the potential for infection. Showering is permitted because water in the shower doesn't enter the vagina and increase the risk of infection. A fluid intake of at least 2 liters daily is recommended to prevent potential urinary tract infection. A multigravid client at 34 weeks gestation with premature rupture of the membranes tests positive for group B streptococcus. The client is having contractions every 4 to 6 minutes. Her vital signs are as follows: blood pressure 120/80, temperature 100 degrees Fahrenheit, pulse 100 beats per minute, respirations 18 breaths per minute. Which of the following would the nurse expect a primary health care provider prescribe? 1. Intravenous penicillin. 2. Intravenous gentamicin sulfate. 3. Intramuscular betamethasone. 4. Intramuscular cefaclor. The correct answer is 1. Because group B streptococcus is a gram-positive bacterium, the primary health care provider probably will prescribe intravenous penicillin to treat the mother's infection and prevent fetal infection. Gentamicin sulfate, which acts on gram-negative bacteria, would be inappropriate. Administering a corticosteroid, such as betamethasone, is inappropriate because the premature rupture of the membranes enhances fetal lung maturity. The lack of amniotic fluid causes early maturation of lung tissue. Cefaclor, which is available only in the oral form, is used for upper and lower respiratory tract infections and urinary tract infections by gram-negative staphylococci. A primigravida client at 30 weeks gestation has been admitted to the hospital with premature rupture of the membranes without contractions. Her cervix is 2 centimeters dilated and 50% effaced. The nurse should next assess the clients. 1. Red blood cell count. 2. Degree of discomfort. 3. Urinary output. 4. Temperature. The correct answer is 4. Premature rupture of the membranes is commonly associated with chorioamnionitis or an infection. A priority assessment for the nurse to make is to document the client's temperature every 2 to 4 hours. Temperature elevation may indicate an infection. Lethargy and an elevated white blood cell count also indicate infection. The red blood cell count would provide information related to anemia, not infection. The client is not in labor. Therefore, assessing the degree of discomfort is not a priority at this time. Urinary output is not a reliable indicator of an infection, such as chorioamnionitis. A multigravida client at 34 weeks gestation visits the hospital because she suspects that her water is broken after testing the leaking fluid with nitrazine paper. The nurse confirms that the client's membranes have ruptured when the paper turns which of the following colors? 1. Yellow. 2. Green. 3. Blue. 4. Red. The correct answer is 3. If the client's membranes have ruptured, the nitrazine paper will turn blue, an alkaline reaction. False positives may occur when the nitrazine paper is exposed to blood or semen. The definitive test for rupture of membranes is Fern testing, where amniotic fluid is allowed to dry on a slide and then viewed under a microscope. Dried amniotic fluid will form a Fern pattern. No other fluid forms this type of pattern. When preparing a multigravida client at 34 weeks gestation, experiencing preterm labor for the shake test performed on amniotic fluid, the nurse would instruct the client that this test is done to evaluate the maturity of which of the following fetal systems? 1. Urinary. 2. Gastrointestinal. 3. Cardiovascular. 4. Pulmonary. The correct answer is 4. The shake test helps determine the maturity of the fetal pulmonary system. The test is based on the fact that surfactant foams, when mixed with ethanol, the more stable the foam, the more mature the fetal pulmonary system. Although the shake test is inexpensive and provides rapid results, problems have been noted with its reliability. Therefore, the lecithin-sphingomyelin ratio is usually determined in conjunction with the shake test. The primary health care provider prescribes betamethasone for a 34-year-old multigravida client at 32 weeks gestation who is experiencing preterm labor. Previously, the client has experienced 1 infant death due to preterm birth at 28 weeks gestation. The nurse explains that this drug is given for which of the following reasons? 1. To enhance fetal lung maturity. 2. To counter the effects of tocolytic therapy. 3. To treat chorioamnionitis. 4. To decrease neonatal production of surfactant. The correct answer is 1. Betamethasone therapy is indicated when the fetal lungs are immature. The fetus must be between 28 and 34 weeks gestation, and birth must be delayed for 24 to 48 hours for the drug to achieve a therapeutic effect. Antibiotics would be used to treat chorioamnionitis. Betamethasone is not an antagonist for tocolytic therapy. It increases, not decreases, the production of neonatal surfactant. In which of the following maternal locations would the nurse place the ultrasound transducer of the external electronic fetal heart rate monitor if a fetus at 34 weeks gestation is in the left occipital-anterior position? 1. Near the symphysis pubis. 2. 2 inches above the umbilicus. 3. Below the umbilicus on the left side. 4. At the level of the umbilicus. The correct answer is 3. As the uterus contracts, the abdominal wall rises and, when external monitoring is used, presses against the transducer. This movement is transmitted into an electrical current, which is then recorded with the fetus in the LOA position. The cardiotransducer should be placed below the umbilicus on the side where the fetal back is located and uterine displacement during contractions is greatest. If the fetal back is near the symphysis pubis, the fetus is presenting as a transverse lie. If the fetus is in a breech position, the fetal back may be at or above the umbilicus. Which statement by the client indicates an understanding of the teaching regarding the use of magnesium sulfate and corticosteroids for preterm labor. 1. I will be on magnesium sulfate and corticosteroids until my baby's due date, so he has the best chance of doing well. 2. The magnesium sulfate is to stop contractions while the corticosteroids increase lung surfactant in my baby, so he can breathe better if he is born early. 3. The goal of the magnesium sulfate and the corticosteroids is to stop contractions and help me get to my due date. 4. If I take this magnesium sulfate and the corticosteroids, my baby won't have to spend any time in the neonatal intensive care unit if he is born. The correct answer is 2. Corticosteroids given IM have been shown to increase fetal lung surfactant and reduce the risk of respiratory distress syndrome in premature infants. It is not a guarantee that a premature newborn would not have problems at birth that would require time in the neonatal intensive care unit. The administration of the corticosteroids is normally completed within 24 to 48 hours. Magnesium sulfate is currently given IV to women in preterm labor to stop contractions and therefore prolong gestation long enough for the corticosteroids to be most effective for the fetus. Magnesium sulfate is not always effective at stopping preterm labor. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following? 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Prematurity is associated with RDS because of the immaturity of the fetal lungs. RDS is not a result of indomethacin. Hyperbilirubinemia is more common in preterm infants. Use of indomethacin to halt preterm labor is not associated with cardiomyopathy in the infant. A nurse is discussing preterm labor in a prenatal class. After class, a client and her partner ask the nurse to identify again the nursing strategies to prevent preterm labor. The clients need further instruction when they state which of the following? 1. I need to stay hydrated all the time. 2. I need to avoid any infections. 3. I should include frequent rest breaks if we travel. 4. Changing to filter cigarettes is helpful. The correct answer is 4. Smoking in any form is contraindicated in pregnancy, regardless of the type of filtering system used. Smoking is a major risk factor for preterm labor and decreased fetal weight. Dehydration is a risk factor for preterm labor, as it's prolonged standing and remaining in one position. Infection is thought to be a primary cause of preterm labor, and the client would need to avoid contracting any type of infection. While taking trips, frequent emptying of the bladder prevents infection and ambulates the woman. The healthcare provider has determined that a preterm labor client at 34 weeks gestation has no fetal fibronectin present. Based on this finding, the nurse would anticipate that within the next week, 1. The client will develop preeclampsia. 2. The fetus will develop mature lungs. 3. The client will not develop preterm labor. 4. The fetus will not develop gestational diabetes. The correct answer is 3. The absence of fetal fibronectin in a vaginal swab between 22 and 37 weeks gestation indicates there is less than 1% risk of developing preterm labor in the next week. Fetal fibronectin is an extracellular protein normally found in fetal membranes and deciduous and has no correlation with preeclampsia, fetal lung maturation, or gestational diabetes. The mother tells the nurse she will be afraid to allow her child with hemophilia to participate in sports because of the danger of injury and bleeding. After explaining that physical fitness is important for children with hemophilia, which of the following activities should the nurse suggest as ideal? 1. Snow skiing. 2. Swimming. 3. Basketball. 4. Gymnastics. The correct answer is 2. Swimming is an ideal activity for a child with hemophilia because it is a non-contact sport. Many non-contact sports and physical activities that do not place excessive strain on joints are also appropriate. Such activities strengthen the muscles surrounding joints and help control bleeding in these areas. Non-contact sports also enhance general mental and physical well-being. Falls and subsequent injury to the child may occur with snow skiing. Basketball is a contact sport and therefore increases the child's risk for injury. Gymnastics is a very strenuous sport. Gymnasts frequently have muscle and joint injuries that result in bleeding episodes.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.